My name is James Epp. I'm an associate professor at Weill Cornell Medicine in New York. Came to the Heart Rhythm to discuss the results of the NODE-302 trial, which is a study using intranasal etripamil to convert spontaneous episodes of paroxysmal supraventricular tachycardia. The aims of the study were to evaluate the continued use of this new intranasal calcium channel blocker to terminate episodes of SVT that occurred spontaneously. Patients were allowed to continue to use the drug for up to 11 doses in this open-label trial. The patient population were patients who had SVT that were enrolled in the NODE-301 trial, which was a randomized control trial of the same medication. Patients who had completed a test dose as well as a randomized dose in that trial were eligible to enroll in this trial. The key findings of the study was that the drug continued to be safe when used in repeated doses. Patients in this trial, 92 patients, had 188 episodes, and of those episodes, there was a conversion rate of 60.2% at 30 minutes and 75.1% at 60 minutes. Take-home messages is that this drug will be available, hopefully, after the next trial is completed. Once we gather enough information and show that it continues to be safe and effective in terminating SVT, the drug may be available for patients who may want to use this medication as an alternative to other therapies like catheter ablation or taking a pill, which may not be effective and has a slow onset of action. This is an open-label study, so it demonstrated the continued safety of the medication as well as the efficacy. We want to take the next step, which is to evaluate the drug in repeated use if an episode of SVT doesn't terminate. This is a trial called the RAPID study, or the NODE-301 Part 2 study. If patients have an episode of SVT, they use the medication. 10 minutes later, if the episode doesn't stop, they take another dose of medication. We're hoping that the combination of having 2 doses of the medication 10 minutes apart may improve the efficacy and still be safe for patients to take. This is a randomized controlled trial. The results, we're very excited, hopefully will be available at the end of the year, and we'll have the answers for you then.